So, good afternoon, everyone. Myself, Dr. Amit Prajapati. I am a critical care specialist and intensivist at Shalby Hospital, Ahmedabad. So today we are here to discuss about the post-COVID syndrome, like post-COVID complication and post-COVID syndromes. So if you have any question regarding post-COVID symptoms, any complication, you can ask me in between my Facebook live. I am Dr. Amit Prajapati. I'm working as an intensivist, like critical care specialist at Shalby Hospital. We are running two COVID hospital, one at the Krishna Shalby Hospital, Ahmedabad, and another is a Vijay Shalby Hospital. So I am seeing the all Corona patients, COVID patient at the this Krishna Shalby Hospital and the Vijay Shalby Hospital, and another like post-COVID patients, like post-COVID syndromes, post-COVID symptoms, if have any, or those patients are negative in the COVID, they will come after in post-COVID ICU at the SG unit of the Selby hospital. So we are handling like post-COVID ICU care as well as the post-COVID OPD. So if you have any symptoms like after the corona, so you can consult me. We have, if you have any question or if you have any doubt about the post COVID, we will answer your question. So if you have any question, you can ask me during my Facebook live. So we'll start with the what kind of symptoms can develop after the post COVID. So what is the post COVID syndrome, we will discuss first. So like that is called as a long COVID. Those patients have a mild or moderate disease. Those have very few signs, very few symptoms. So that will recover after 1 and 1.5 month. So in if patient in a mild to moderate category, that will recover within a 1 or 1.5 month. But those who have a severe symptoms like severe category of the COVID pneumonia, that will take a time to the 6 month also to recover from the post COVID in the severe condition. So let us discuss though which patients required more care or which patient recover early. So according to the city severity, the post like corona COVID pneumonia is divided in a three category: mild, moderate, and the severe category. So according to the city severity, means city scan score, city severity score, the divide COVID pneumonia in a three category. If it is that score is out of 25. So if it is that score less than 8 out of 25, that is in a mild category. The score, city severity score between 8 to 15, so that is a moderate category. And if it is city severity score is more than 15, so that patient is end up in the severe category of the COVID pneumonia. So the management in the mild, moderate, and severe category are different, and the post-COVID sequelae and the symptoms and the complication are different in the mild, moderate, and the severe category of the COVID pneumonia. So let us start how this term is coined, like post-COVID syndromes. So those patients are mild and moderate category have some signs, some symptoms after from the recovery of the corona. So these are mild symptoms, and some like severe category that develop the more severe symptoms, more severe complication after the COVID. So these two, like mild to moderate and the severe category, have different kind of symptoms, complication, and the sequelae after the coronavirus pneumonia. So why the post-acute COVID-19 syndromes we call, because in which they experience persistent symptoms after recovering from their initial illness. So even if you discharge from the hospitals, you have some symptoms. So for that we are discussing here what are the symptoms and what is the management of that symptoms. So let us discuss like what are the signs and symptoms that is linger over the time. So first, most common symptoms I encounter during my OPD is the patient complaining about the fatigue and the weakness. Most of patients who recovered from the mild to moderate category, even up to the 1 and 1.5 month, patient feel the weakness. So nothing to be worried if you feel the weakness or the fatigueness, nothing to be worried, because what happened in the COVID pneumonia, in the COVID infection, the muscle protein or ATP is lysis. So you feel the muscle weakness. So that due to that muscle weakness, the patient are feeling the post-COVID weakness and post-COVID fatigueness. So whatever organ you will use, you will feel the weakness about that. Like if you walk longer than the 10 or 5 minutes, you feel the tiredness in the legs. So because that muscle are used, leg muscle are more used during the walking. So then after you feeling the weakness in your leg. So that is a muscle weakness. Like if you're doing the deep breathing exercise, so then after you feel the chest tightness or the chest muscle weakness. So that is again that is a weakness. So that is not due to the pneumonia you feel the chest tightness, but that is due to the muscle weakness you feel like this. So muscle weakness and the fatigueness, it's the most common symptoms after the post-COVID. So don't worry about it. If you feel these kind of symptoms, there is nothing to be worried. Another is that sometimes patient have coughing. Even after recovering from the COVID pneumonia, you feel the coughing, but that is a typical morning cough. Whatever the COVID patients, they feel the morning cough only. During the daytime or during the evening time, there is nothing, no cough. But when they wake up and go for the brushing, at that time, the one or two spout of the cough will come out. So that is a typical of the post-COVID because your lung is recovering from the pneumonia. So you have some just little bit of cough. That is a morning cough. So again, here there is a no worry. If you have morning one or two spout of the cough, that is nothing to be worried. So just the modification of the some drugs that will help. So muscle weakness, fatigue, and the morning cough. It is a common post-COVID symptoms. In that, nothing to be worried. That will let go out by the time. Another symptoms is the joint pain and the chest pain. Again, I emphasize patient feeling the chest pain when they are doing the deep breathing exercise, or the sometimes this kind of patient doing the spirometry, the breathing exercise. So that's why that patient feel the chest pain, or sometimes patient become fatigued due to the after doing the heavy deep breathing exercise. So that is again common things. So in that what we have to do, like you have to go slowly. Like initially you have to do the deep breathing exercise but in a lesser number. Then if you are comfortable with the less number of the deep breathing exercise, then you can increase your the exercise time. So by this way you can like train your muscle regularly, and then you will increase your exercise time. By this way you will become less fatigued during your exercise. So that is by this way you can decrease your fatigueness. Immediately after, like what happened immediately after discharge from the hospital, what happened at the home, the patient doing heavy exercise, even sometimes doing the immediate work. So what they leads, that leads to the more muscle weakness and the fatigueness. So this is a disease of the rest. So even during the hospitalization as well as the post hospitalization, you have to go for the rest. More and more rest, you will recover early. So like if you have a chest pain, if you have a body pain, if you have a leg pain, just give them rest. By the time that will recover automatically. Another, like you feel the headache, that is again most common symptoms after the post COVID. Like what happened, you again the theory is the same, the muscle weakness. So if you are using your brain, if you are using more work, you will feel headache definitely. So again the rest. So take proper sleep. Even if you are not working, initial post COVID initial 7 days isolation you should maintain after the post discharge also. So during that time you also take a sleep in the afternoon session also. So then and then you have to optimize, or you have to give the rest to your body. Then and then these kind of symptoms will be go away by itself. So headache is also this common symptoms after the post COVID. Another, the fast and pounding heartbeat, like palpitation. Like those patients have moderate to severe pneumonia. They have a pneumonia like lesions in the lungs. So what happens there, when they are changing their position in the bed, like from the supine to the lateral position, they feel the palpitation, like the heart is beating like the. So that is a palpitation. So that is again, that is a common. Like what happened if you are changing the position, if you are changing the position, the lungs also inflame. Patient, the lungs have a pneumonia, so body will try to adjust the blood supply. So the heartbeat will be increased while you are changing the position. So that is again that is a common symptoms, the palpitation and the bounding heartbeats you feel when you are changing the position from supine to the lateral or lateral to the prone position. So that is again, that is a common, that is nothing to be worried, that also will go by the time. So don't be a worry if you are have a palpitation even after the discharge. Like those patients have a CT severity of more than 15 or some more than 12. This kind of patients also found the palpitation while they are changing the position. Even sometimes what happens, they are getting up from the bed and going for the bathroom. They again they feel the palpitation. So that is also common. So nothing to be worried in that. That is a common, and that is not a life threatening condition at all. So but watchful for that, if you have increase in the time of the palpitation, then you have to consult the cardiologist or your physicians as well. Another, like memory, concentration and the sleep problem, that is again, that is due to the anxiety. Like I think everybody have the anxiety of the COVID. Like since last almost 6 to 8 months, the people and the people are suffering from the COVID and the how of the COVID that leads to the sleep problem. So that will create the anxiety. So again, this is a common. But like if you have hallucination, some visual problem, like increase like because what happened due to this crisis, due to this COVID crisis, also people have some financial crisis also. So that's why also patient have a, or the people have a anxiety. So in that condition you have to consult your the psychiatrist also, because also we are doing special psychiatric clinic for the post COVID patients. So that is again common. But that things you can relieve by the meditation, or either you can you consult your physician as well as you consult the psychiatrist also. So by this way you can come out from this kind of condition also. Like so this is about the like mild to moderate condition. These patients have hospitalization of the 7 or 10 days. Like in the mild condition, what we are discharging the patient in 7 or 10 days, and in during this follow up, this kind of patient have this muscle weakness, joint pain, fatigueness, palpitation. These are the symptoms are the common, and that will go by the time. Almost 4 to 6 weeks, all the symptoms will come go on. Even after this, if this kind of symptoms is persist, then and then you have too much worry about it, and then you at that time you have to consult your the physicians, your doctors. Then they can help you. Another, like in the severe condition, the already mentioned, those city severity score is more than 15 in the CT scan. So this kind of the severe condition, patient have more symptoms. Like what happened, those patients have a ICU stays of the more than 10 or 15 days. They have another type of complication, they have another type of the symptoms. So let us discuss now. So these are the like muscle weakness, fatigueness, chest pain, palpitation, headache. These are the mild to moderate category. Okay, now we will discuss about what happened into the severe category patients, those who discharge from the hospital after 1 or 2 month hospitalization. Those patients required more than 15 days of ICU stays. They have a more kind of damage, more kind of complication. So what happened in that patient? One most common organ is a lung. Lung is damaged because of the pneumonia. Lung are damaged. So 20, if the more than 15% score into CT severity, they have more lung damage. So they have breathing issue. The hypoxia, oxygen level will be low. Sometimes what happened, when the patient came to us in the ICU will revive, the oxygen requirement will decrease, but during at the time of the discharge, some like 1 or 2 liter of O2 patient is required. So that is also there is a post COVID sequelae. What we are doing in that case, like 1 or 2 months will stay in a hospital, this kind of patient, then this patient will discharge with the O2 at home, and will keep regular follow-up of this kind of patient. And over the month, what we see, after 2 or 3 months, the patient not required the oxygen at home. So in a severe category, the patient required almost 1 to 6 months of total recovery. So we are also getting right now the 4 and 6 month patients on a follow-up with 1 or 2 liter O2. So there is also possibility. But again, in this condition, don't worry. You have to just follow your doctor's advice. That is also possible. If you have 1 or 2 liter oxygen at home, don't worry. Just take it 1 or 2 liter O2 and get the regular follow-up of your doctor. That will 2 or 3 months of the 4 month over the 6 month, that will oxygen will go on and you can breathe on from the air. So that is also the post COVID sequelae, that is a post COVID hypoxia. 1 or 2 liter O2 is required at home. Again, that is also can be treatable or also can be a recovery reversible disease, so don't worry about it. Another, the heart, because what happened sometimes due to the severe pneumonia, the severe hypoxia, that leads to the some damage into the heart. So like this, because during the breathing difficulty, the heart will pumping faster, that leads to the tachycardia. Sometimes due to the hypoxia, patient leads to the myocardial infarction. Another second is a thrombosis. There is a high risk of the thrombosis in the COVID patients. So that's why we are regularly check up the D dimer level. If your D dimer level is high, so that means that suggests there are higher chances of the thrombosis. So that leads to the three most common complication. One is a myocardial heart attack, like myocardial infarction. Second is a pulmonary embolism, and third one is a stroke. So that is a common post-COVID complication, post-COVID sequelae. So the this these kind of post-COVID patients have end up with the myocardial infarction, is sometimes hypoxic heart disease also. So this is also the dangerous. So these kind of patients need urgent evaluation by the physician, critical care specialist, or by the cardiologist. So at that time you have to consult. If you have a chest pain that is persistent, then definitely you have to go to the cardiologist for your consultation. Because last since almost 6 months we seen many MI with COVID positive patients. We did the many angioplasty in the COVID positive patients also. So that is again the common scenario we are encountered right now. Then again, another organ is a brain. Brain is also involved. So we seen uh, one is a stroke patient. The post-COVID, due to the thrombosis, patient end up with the stroke, like the paralysis attack. So that is also the common things. The post-COVID, that is also called the post-COVID sequelae, post-COVID complication due to the COVID pneumonia. Another entity is a GBS, that is a Guillain-Barré syndrome. What happened into the COVID pneumonia? That is a muscle and the neuropathy, muscle neuropathy, that leads to the weakness in the muscle as well as the nerves. So that is Guillain-Barré syndrome is the disease of the muscles and the nerve weakness. So that is also common. We find many patients during this post-COVID area, they found patient developed the GBS, Guillain-Barré syndrome. This Guillain-Barré syndrome have low incidence in the past, but since last 6 months, that incidence is pick up. So that is also common, the post-viral Guillain-Barré syndrome. And third one, it's a brain infection, because any kind of virus that leads to the meningitis or encephalitis. So that that is also we find during this last 6 months the patient come with the brain infection. So these are the organ damage like the lungs, brain, and the heart. can happen after the post COVID pneumonia. Even that will happen during the COVID pneumonia treatment as well, because we found many kind of pulmonary embolism, stroke, MI during the COVID pneumonia treatment. So that's why that whole the things in the mild to moderate, that is a post COVID syndrome, and in the severe category COVID pneumonia, patient develop these kind of the complication like the stroke, pulmonary embolism, myocardial infarction, Guillain-Barré syndrome. So that all are the post-COVID sequelae or the post-COVID complication we can say, that is due to the thrombosis. That is due to the hypercoagulable stage thrombogenicity of the COVID pneumonia. So any question from the audience so we can take. Uh, what are the chances of the reinfection in the COVID patient? Again, we are not still like since almost 6 or 8 months, we treat almost more than 2,000 patients. Still, only I encounter only the one patient, but we cannot sure that is a reinfection or that is a sequelae of the post-COVID complication. So we are not sure that can be reinfection of the COVID patients or not. So we are not sure still now. But over the year, then after if the treated patient come with again for the reinfection, then we can consider as a COVID infection can be a reinfectious. But still now not that much data. Another question, નોર્મલ કોવિડમાં ફેબીફ્લુની કોઈ આડઅસર અથવા 28 days પછી. Yes, like again, there is a post-COVID. What to do after the post-COVID? What we are doing, like after the hospital stay, like what happened from the initial, we put the patient 14 days into the hospital. Now what we are doing, if patient is become asymptomatic, patient will recover from the pneumonia, will discharge the patient early as well. So what we are doing, 7 days isolation. 7 days isolation is at home post COVID is required because these patients are still less into the hospital. So that's why we put the patient 7 days isolation. So that is a post COVID scenario. Another question is, does the patient need ICU treatment even after COVID negative? Yes, definitely. What happened like in the severe category? Those patients have a severe category pneumonia. The lungs are damaged more. But if you do the COVID testing after the 14 days, the COVID test will be negative. But what happened? Patient still hypoxic. That means after COVID negative report, COVID virus damaged the lung. So that's why patient have a pneumonia and patient is hypoxic. So definitely this kind of hypoxic means low O2. Patient required the continuous treatment because we discharge the patient after 2 or 3 months after the complete recovery from the hospital. So these like higher severe category of pneumonia that required more stay even after the COVID negative report, patient required the further treatment because of the for the lung pneumonia. Another question is the post, how to increase the immunity in the possible second time. Yes, definitely we are not sure about the second reinfection rate of the corona. So even after recovering from the new COVID pneumonia or the COVID infection, you have to follow three things definitely. One is wear the mask, second is social distancing, and third one is wash your hand regularly. So these three things you have to follow even after the post COVID pneumonia because we are not sure about the COVID reinfection. Okay, so uh, these are the like symptoms, signs, and the complication and the sequelae we discuss. Now we will discuss what to do, like what are the treatment modality, what the things you have to taken care from come out from this kind of the post COVID symptoms. So let us we discuss, or you can ask me any question during this Facebook live also because Till now, we discuss about the post-COVID syndromes, post-COVID sequelae, post-COVID complication. Now, we will discuss some how to deal with it. So, one thing I emphasize, we are doing the two program right now at the Shalby Hospital. One is a rehabilitation program, and one is a ICU rehabilitation care. So, what is a rehabilitation? So, those patients have mild to moderate symptoms for the COVID infection. These patients have a very mild symptoms later on. After at home, patient have very little symptoms. So, for that, we are doing the rehabilitation program. What in that what we are doing? We are doing regularly CRP, D dimer, and the CBC measurement every weekly. Another, if patient have a breathing issue, so we'll do the breathing exercise. Like we are consulting our patient to the physiotherapist. That physiotherapy will give the advice how to do the regular breathing exercise that will help into the come out from the breathing difficulty. Even for the hypoxia improvement, that lung exercise is required even after the discharge from the hospital. Another, diet. So dietitian consultation, your physician consultation is very important, because the most important part of post COVID recovery is your diet. Because what happened in the COVID pneumonia, COVID infection, what happened? The muscle protein, muscle ATP is lysis. So muscle protein is lysed. So you require more protein in your diet. By this way, you can come out from this kind of muscle weakness. So if you take high protein, what we are doing during the hospital stay, also we give the more protein diet to the patient. So when the patient recovered, so they will get the protein from by the time. So even if you discharge after the hospital from the hospital to the home, you have a high intake of the protein. Like those are the vegetarian, they have to take the more kathod, like the mugs and everything. And the non-vegetarian also take the eggs. And if you cannot supplement the protein from the food, you can take the protein powders also. So by the increase the intake of the protein in your food, definitely these are the symptoms you can deal very easy, like the muscle weakness, fatigueness, breathing issue, chest pain, chest heaviness. So if you take more protein in your diet, then definitely that will help. And the fourth part, it's so the these all are discussion about the physical, like for the physician consultation, dietitian consultation, and last one is your the mental health. Because due to this financial crisis as well as due to the COVID infections, the patient feeling very lonely. They found patient become very lonely. Also they found insomnia, so you require the psychiatrist consultation. So do not hesitate to consult the psychiatrist if you found any kind of the mental disturbance after the post COVID scenario. So by this way, like the physician consultation, regular health checkup, like regular blood investigation, the physiotherapist consultation, dietitian consultation, and from the psychiatrist consultant, we are running this rehabilitation program at the Selby Hospital. Another one is a post-COVID rehabilitation for the ICU patient. Because what happened, the patient after the 14 days, patient become negative by the COVID from the nasopharyngeal test, the patient become negative, but patient have still hypoxia. So these kind of patients definitely require the ICU care. So especially like the for the non-COVID pneumonia, we are running the post-COVID pneumonia rehabilitation ICU care. So for this, what we are doing, like we are managing the same with the sometimes patient develop the secondary bacterial or fungal infection. Patient require the BiPAP support. Patient require the oxygen supports also. So we are doing this kind of rehabilitation ICU care, specially designated the post-COVID ICU at the Selby Hospital. So by this way, like from the physician point of view, from the critical care specialist, from the ICU point of view, and with the help of the dietitian, with the help of the physiotherapist, with the help of the psychiatrist, we are running a very good rehabilitation program for those who patient are recovered from the COVID pneumonia or from the COVID infection. We are providing the all the kind of service like for the mild to moderate disease as well as for the severe category of the disease. So, so that's it from the my side. Like what we discuss about the post-COVID syndromes, post-COVID complication, post-COVID sequelae, and also emphasize about the what to do in these kind of conditions. So by this way, we can help you in this post-COVID scenario also. So if you have any question, you can ask me right now, or also you can me ask me later on. I will reply you on the Facebook page. We'll take one or two question. Okay, somebody asked, I have the headache since 20 days and headache over eyes. It is a COVID infection. I take Nimesulide for the 10 days, then I have 90% relief. Okay. So sometimes what happen like if you have a COVID infection, so you have some sinusitis or due to the this atmosphere change, also the patient have sinusitis. Due to this sinusitis, patient have the headache also. So again, the headache also the sign of the COVID infection also. So for that, what you have to do, you have to just go for the RT-PCR test and get it done. If it is positive, that is due to the COVID-19 infection. If it is negative, that is due to the another flu infection. So by this way, you can easily rule out by doing the RT-PCR. The again, the in a post-COVID patient, that is also common. The patient have a headache. Again, that is due to the sinusitis. And sometimes what happens due to the muscle weakness, patients feel the headache because what happened after discharge from the hospital, patient doing the hard work, patient engaged in the work, so they have a headache because of the fatigueness. So that's why again you have to take a rest initial stage and then you have to start go for the work. If you feel comfortable, if you feel fit, then go and then you start your work. Another another question is immunity, how to boost up our immunity. Already, okay. So most common is the food. So there is not required any kind of tablet to boost up your immunity that is from your food. If you are high intake of the protein, if you high intake of the vitamin C in your food, that is enough for to boost up your immunity. Okay, fine. So again, thank you very much. Myself, Dr. Amit Prajapati. So if you have any question regarding the even for the COVID infection, COVID pneumonia, and the post-COVID syndrome or the post-COVID sequelae complication, you can me ask me on the Facebook page anytime. I will answer you.